Don't be stressed out on junctional block or uh, those special terms.
Another course for ether?
There is.
Oh yeah.
There is. Yes.
I had a hard time
So
telling with like the waves, what's an over exaggerated wave and what's
if it's
unnormal.
there's measurements. See, we didn't even go because this is just introduction. See, you can't study everything in 12 weeks. Everything that's with so we want you to have a solid introduction. So first, let's go over this one, okay? And I'm glad that you're at least it means that you're trying to learn. No, you're learning, not trying. You're learning already. Okay, so let's look at this one. Tracing the blood flow from the heart to the right hand. So from the heart to the right hand, so meaning from the left side, we find that blood leaves the heart, passes through the aorta, the subclavian, the acral, and brachial arteries, and through either the radial or ulnar. Which artery is missing from this sequence? Which one?
Brachiocephalus.
Very good. You answered that one. Next.
We did that one in
We
class.
did that
You
one
did that
yesterday.
one. Number 5, 6 is normally arterial. Number 7, 8. High resistance will decrease the blood flow. Obviously, right? If there's high resistance, I'm thinking that there's constriction, it will decrease. It's very hard to flow. And if the pressure is high, it will increase the blood flow. That's the purpose of increasing the pressure, right? Like with the hose, you increase the pressure, the water will flow. So that's the purpose. That's why we increase because we want that flow to happen. So it will increase the blood flow. And you appreciate this more when we talk about our renal system. Mitral and tricuspid valves close when? After the ventricles are filled with blood. You understand that, right? That's why you had to look at your cardiac cycle. The heart is just a lot to study. During the cardiac cycle, the aortic and pulmonic valves close when?
After the ventricles contract?
After the ventricles.
Yeah, because they'd have to
contract.
contract to push the blood in,
After.
and then it closes.
You push the blood
prevent
in.
backflow.
You push the blood into aorta and the pulmonary
then
artery,
the valves close.
and then the valves will close.
Okay,
This
that's what I thought.
the aortic and pulmonic valves are not. I'm thinking you're confused. You may be thinking that these are the AV valves.
They're the semilunar valves.
Yeah,
right?
you may think it's atrial valve. So look at the word aorta and pulmonary. So that's the outside, okay? The arteries. Next, continuous increase in left ventricular filling pressures will result initially in pulmonary, right? Because the left side is receiving blood from the lungs. So if there's resistance from the blood being returned from the lungs, there will be back. That's when you start hearing RALs, fluid in the lungs of patients. You know that they have heart problems. They have no pneumonia. It's just you can hear the fluid in the lungs. What's the major cardiovascular center? So it's the medulla. The medulla, okay? Don't write brain stem. The major center is the medulla. Next. So if there's spas, is it early or late? Obviously,
Late.
it's late stage of infection. So Duncan has diabetes. He circulates. How might this condition affect his vulnerability to infection? How might this condition affect? So if there is damage to the small blood vessels, circulation is impaired, how will it affect?
He can't get anything there
Correct.
because there's
Very
not good circulation.
Yes. So
No good blood flow.
yeah,
So it's not meeting the tissue's needs, which leads.
it's not meeting the tissue's needs. Very good. Which needs the nutrients. Number 2.
And it could lead to
number
an
1.
infection.
Yes, the white blood cells can't get there, right? If it's damaged, how can your soldiers get there, okay? So that's what you're going to explain to your people. That's why they have to make sure they have
Check
good
their
blood
feet.
flow. Check their feet. That's right. That's the danger with diabetic neuropathy. So they can't feel anything. Which of the 4 has the thinnest wall and why?
The atrium, because they ain't got a pump.
The right and left atrium. Yes, because they don't have to pump too far. It's just their neighbors. And besides, the blood goes down by gravity. So they really don't have to work hard, right? Next, sequence contraction of the heart chamber is what?
See? The atria by both.
Yes, letter C. Freshly oxygenated blood is first received by the
Left
left
atrium.
atrium. Trace in your head 1 drop of blood from the time it enters the right until it enters the left. It is called
Pulmonary
circuit. Okay, and then from the left to the until it enters the right, that's your systemic circuit. Very good. Very short nursing student is asked to measure the blood pressure of a very tall person. So it's the dorsalis pedis artery. Okay. Some people were saying it may be the, what did they say? The popliteal. It's over here. That's not. So it says here you blood pressure at the foot. So that's the dorsalis pedis artery. Okay. Mrs. Johnson brought to the ER, auto accident, hemorrhaging, rapid thready pulse, blood pressure within normal. So what are the compens? Here I'm asking you for, what did you write? You can write blood vessel compensation and endocrine compensation. And it's an automatic thing. These two body systems, it's beyond their control. They automatically try as much as possible to correct your problem. Unless there's an ongoing loss, like she's bleeding, then you have to then replace it. But if it's, it can be controlled by your internal network, they will do it. Okay, for the EKG,
They were all abnormal.
I just want
There's only one normal one on the end.
yes, so
I
I
didn't
just
see a
want
normal
to
one. Which one's normal?
Oh, page 7.
That one's not normal.
Normal sinus rhythm.
where?
I don't
Page
know.
7 is
The
back
one
here.
after the ventricular fibrillation.
That's not normal because the QRS doesn't come down. But then I looked on here too.
And it did it come
Yeah,
down?
no.
Is this the one?
No. It's page 7.
What's the closest one to normal?
That one.
Yeah.
See?
That's normal because the closest
It doesn't
one to
come
normal.
down. It's the
It's got a
closest
P
to
wave,
normal,
got
a
but
T
the
wave,
QRS
QRS.
isn't
The
normal.
QRS is not really
Yeah.
that.
Well,
What's
yeah,
The edge still
it-
doesn't go down, but
it. I'm
It's
looking at it
60
clearly. You can
feet
write normal
per minute.
because it doesn't show. This one is showing.
You
it
see, in this one
clearly.
it doesn't show it
But
down
it's
either.
okay.
what page is that?
Well, if you
The
count
last
1,
one.
2, 3, 4,
So
5, there's 5
at
boxes.
least
5
with the
is 60.
EKG, you can have just don't leave it blank. And I don't want to see normal, abnormal. So just write. You just say very fast rhythm maybe. You say I don't see the P wave. I just want to see you guys analyzing that EKG.
Yeah, that's what I wrote, just descriptions
If you
of it.
write something and I will look at the EKG, if it makes sense, at least I know that you are understanding how an EKG looks like and how, what to look for. And at least if it's AFib or VFib, that one you should know, okay?
What's the
Okay?
difference between AFib and VFib?
It's in the atrium, the other one's in the ventricle.
Okay.
Now I'm just, well, yeah.
I don't know, I mean, what's the
Well,
difference?
A-
This
AFib.
one, would you say this one is VFib here, and then this one's AFib here? Right?
That one is VFib,
This
yes,
one.
that's obviously VFib.
But then this one, because
Where?
AFib. Number 6.
Oh,
right
ventricular fibrillation, okay.
Right after the
This one?
asystole.
So AFib is the asystole?
Right after
Is that the same thing
asystole.
as asystole?
She's looking at page 6.
Oh, you mean this one?
Yeah.
Yeah.
This one?
No, the
What is that
second
one?
one, the middle one.
No, you wrote asystole.
Yeah.
Yeah.
Very good.
But
And
then
you
the
wrote
second
Then where
one.
would be,
this one?
AFib.
Yes.
AFib.
Yes.
Okay.
Yes.
okay, so this is AFib.
Is it AFib or is it the ventricle's not relaxing at all and going straight into the atrium contracting?
This one here?
It says the contraction
You
of the
can-
atria is very erratic.
That's the explanation for AFib.
Oh, okay.
Okay.
Oh, I'm so proud of you guys.
Okay, so
Very
there's no
good.
direction period between the contraction
Now,
of the atria and the ventricles.
Before we,
It just
who has the syllabus?
Okay, got it. Okay.
So everybody, I just want to let you know, I will not be here February 20.
February 22.
Yes. No, not 22. Sorry. 24. Feb 24, I will not be here. We don't have a scheduled test on that day, but what I'm going to make sure that On Monday, the 22nd, whatever it is we're covering, I'm going to give you worksheets or activities to maybe a take-home
week.
little quiz. Like this is, I consider like a little quiz, to make sure that your brain cells are still in study mode. But I've been called.
Isn't that President's Weekend or not
I don't
President's
know,
Weekend?
but I won't be here.
Isn't that President's Weekend?
Oh yeah, Feb 15. So just so you know, okay? I won't be here.
Okay.
Remind me that I won't be here. I mean, remind me to tell you.
Remind you on the 22nd that you won't be here on the 24th.
Yes, to remind you. Okay, I want to talk we're talking about the lymph. Oh, give me your ito. Did you understand this one?
So
You have a test
that
next
you're not
week,
gonna
right?
put a ton of those on the test.
You have a test next Wednesday, right?
Yes.
Okay. No. Your test on Wednesday is heart and blood vessels. Don't forget, you should be able to compute cardiac output, which is heart rate times stroke volume, right? You should be able to compute for a net filtration pressure. I know I will ask you to compute for that one.
Are you gonna give us I'm assuming you're gonna give us the information of the patient that has the so many beats per minute.
Yeah, of course.
And how many liters per.
Of course.
Okay.
Okay? Okay. And times stroke volume.
Yeah, and you want it in liter form versus milliliter, because when you multiply it, it comes out to milliliter form, and then they convert it to liters.
What?
Yeah, in the
What
book.
was I going to say?
So a normal person would be 5.25 liters, because 75 times 70, and then you.
Always bring your textbooks with you. Always bring your books with you. Please, right? I told you that. Every time we meet, I expect you to bring your textbooks with you. Okay? So I want to talk. Also, again, let's review our blood flow before we study our lymphatic system. This is the right atrium, left atrium, right ventricle, left ventricle. Is that cardiac cycle getting better for you guys? The cardiac cycle, that picture?
Oh, that's kind of confusing, but
It's getting
there's a
better.
game on the computer with this this thing right here. So it's helping me label each of the sections.
That's good. Okay, so let's, again, this is your superior vena cava, right? There's your inferior vena cava.
How come it's not on the bottom like in the pictures? They have
Yes,
it under
because it's
the
just
right
my
ventricle.
It's my drawing.
Oh, is that what it is? Because
Yeah.
that confuses me. I'm thinking it's on top of the right atrium, and
I
in the
need to draw
pictures.
it like this because I want to show that it enters the right atrium.
Oh, okay.
So the blood is going that way, and then to the right atrium, right ventricle. This is your pulmonary artery going to the lungs, right? Okay. And then the artery breaks into capillaries. In the lungs. This is my lungs. So there's your capillaries, where it picks up oxygen and it unloads the carbon dioxide, and it leaves. So from the capillaries, they all empty into the vein. So this is your pulmonary vein, which then enters the left atrium carrying oxygenated blood. Okay, from the left atrium to the left ventricle, and then exit. This is your aorta. So the ascending aorta, descending aorta. The descending aorta has the thoracic aorta, descending abdominal aorta. So then it branches. Let's say there's the renal artery. So the artery breaks into capillaries right here, right? And then there's your kidneys, for example. And then from the kidney, it will pick up, right? You have the renal vein. And this vein, so it's always the capillaries where it breaks down into small ones. So this is capillaries. And then the vein will join your inferior vena cava. So let's say you have this smaller artery, the iliac artery, going down the femoral, going down, let's say, to your popliteal artery, to your leg. So then here it will break into capillaries, right, to nourish my leg muscles. This is capillaries. And then the capillaries will empty into a vein. So popliteal vein, then you have iliac femoral vein, then iliac, then join the inferior vena cava.
That's the capillary bed down there.
Yes, that's the capillary bed. Okay? So this is my leg, the capillary bed. So then empty. So that's how it always. It's like this is like the capillary is like a dipping loop, right? It's always they. That's where the artery and the vein meets. It's always this cycle in any part of the body. Let's say gastric artery over here.
So there's always capillaries in between a renal artery and
So let's say
a vein.
This is the capillary bed, let's say for the stomach. So this is the stomach.
And then you're going to have a vein that leads back
And
to
then
this
from the
inferior
capillaries,
vena.
veins collect, very good. And then they
Go back
join
to-
the inferior
okay.
vena cava.
Alright.
Also join inferior vena cava. They always empty to the inferior vena cava. I know it's not nice, but I hope you get the idea. Did you get a haircut? You got a haircut? So you get the picture, everybody. I want to talk about aneurysm. I don't think we talked about aneurysm. Aneurysm is always, when you say aneurysm, you always assume or you know that it's a problem with what? Artery or vein?
Artery.
Always artery, right? And then the vein is always the thrombosis. That's it. So why aneurysm always in the artery? And someone was asking me, why is it when there's a prolapse, it's always mitral valve prolapse? It's always the mitral valve that prolapses, not the tricuspid valve. Okay, so those are very good questions. First, with aneurysm, we know that the artery. What's a key feature with arteries? It's very muscular, right? And then there's two layers of elastic fibers. Whereas veins, very thin muscle, very, very thin muscle, and there's no elastic fibers, right? That's why it's nice to study the anatomy. And this one still has high pressure. The muscular contraction of your arteries, does it make sense? It's able to keep that pressure. It's able to maintain pressure. Then when we go down to your capillaries, that pressure is the key, right, to push your nutrients out. So once they collect here, there's no more pressure. What sucks the fluid back, do you remember, is just the albumin, your protein. So there's no pressure. What keeps moving them is now your skeletal muscle. They're the ones that squeeze the fluid back up. So that's why. Can you imagine if there's a plug here from cholesterol plug, the fact that you have a thick muscle layer, right? So it's going to This is what happens with aneurysm. So wherever there's a resistance, or maybe there's a damage, let's say to your elastic fibers, so the arteries harden somewhere here, let's say. So it can either be from cholesterol plaque or hardening of the arteries from damage, maybe cigarette smoke or any kind of chemical damage. So when this hardens, this will still contract, right? And if this contracts, we'll try to push this one, the elastic fibers, they can bulge still. They can't just go back to their original shape because the elastic fibers are damaged. And that aneurysm cannot happen here because they have no elastic fibers. Elastic fibers are the only ones that allow your wall to stretch, and then it should go back to its original shape. You don't have elastic fibers in your veins. That's why it's impossible to have aneurysm in your veins. You have elastic fibers only in your arteries.
So what if you have an aneurysm in the brain? How does it affect
Stroke.
the arteries?
Arteries always.
Well, how do you get plaque or hardening of the arteries in the head? So what exactly is
million
causing the aneurysm?
How can you get plaque?
Well,
It's the
what is
same.
it causing the aneurysm in your
I
brain?
don't know what's causing the aneurysm. Maybe there's something. It always starts with a plug, something that constricts this one. Can be cholesterol. I don't know what's in. What other? The very very common one is cholesterol or a dissolved blood. So it's very possible, and they say that if you read new articles, they say that a lot of the people, all of us, they say, I forgot the name of that author. He was so bold in claiming that all of us will have some form of a clot just because of the lifestyle that we live. But because we're healthy, this clot is not permitted to be big enough to cause any obstruction. So when the clot dislodges and it's still small enough, you may be able to flush it out of your system. Flush it out to your kidneys. That's the only one we're going to talk about that. But if it dislodges and then you complicate that with any hardening somewhere, you're not healthy. Maybe you smoke or exposure to that chemicals like asbestos or whatever. So there's hardening somewhere. And then on top of that, you add, as we get old, you know that as we get old, your fibers just naturally harden. So it's called degenerative atherosclerosis. So as we get old, it just naturally hardens. It just is not as pliable as it used to. So you include to that problem any clot right there, you're a candidate for a brain aneurysm. But it's very, very interesting. That's right, I didn't include the
I had
brain
a
of
friend
the
die
brain.
of a brain aneurysm in her 20s, so I was
Yeah.
curious.
So do you understand why we'll have aneurysm only in the arteries, not the veins? Right? You don't have elastic fibers in your veins. It's impossible to stretch them and then burst. It's impossible. You don't have it. This is a problem with elasticity. Okay? Thrombosis is a problem with your veins only. Because with the veins, there's not enough pressure to push. Here, at least, the blood the blood keeps moving because there's pressure from the constriction of the artery itself. Here, the movement of the blood in your veins is dependent on you moving. Is dependent on skeletal muscle contracting and sandwiching them, squeezing them. So that's why thrombosis is a problem here in the vein and not in the artery. Does it make sense? And look at this picture, by the way. You have your capillary, and capillary is always the smallest one where there's resistance, right? Constriction. So they all, everything, look at, everything in your systemic, your viscera, they collect into a big, big, big vein. Where is the next set of capillaries? Lungs. So it's always, whether if you have a thrombosis and it dislodges, it embolizes, it will always settle in the first set of constriction it encounters, which is always in your lungs. Okay? That's why, and if it's massive embolism, you will die instantly. Okay? Next, this mitral valve probe. Do you have any? Hopefully, you can make your own picture like this. By the way, in the test on your upcoming test on the heart and blood vessels, I want you to know by heart. I want you to master the flow of blood. So you imagine yourself to be the blood, and you imagine the structures that you will pass through, beginning with this one maybe. So you just imagine yourselves, okay? Then go like this, then go like that, then go like that. So just be able to name these structures. I remember in the past I always asked that part. So you know it, you should know it. And I'm sure you already know it. It's very easy, okay? Next, why do we always have mitral valve problems and not tricuspid valve problems? Can you guess? I'm sure you can guess. I'm sure you can guess. Look at, where is the right? Where's the right? Do you remember? How can you differentiate the right from the left by looking at it? What's the main difference? The right is
Thicker.
the right is
Thinner.
than the
The
left.
left
Very
is
good. Because the right only pumps the blood where? To the lungs. Even though the right and the left, even though both of them are pumping the same amount of blood, the right really doesn't have to pump, doesn't use so much pressure, right? It will deliberate. It's so near, they're neighbors. Whereas the left side always has to pump harder, stronger. So because this pumps stronger, which one has the tendency for prolapse then? If you have any resistance, would it be this one, the mitral valve, or the tricuspid valve? Mitral valve. Okay? So that's why this is, the left side always prolapses first. That's the most common mitral valve prolapse. Okay? So I think we discussed everything about the heart already. Well, not everything, but that's enough for us. Then, if you want, once you go into the nursing program, you will learn more. But at least you have a good foundation. So now we're gonna start